I'll be talking to you about breast augmentation today and what are the two planes in which the breast implant goes. If you're someone who is contemplating breast implant surgery, then this video is for you because I'll be explaining you what are the two different planes in which we put an implant and how it makes a difference, how to make a decision between these two, and which one is suitable for you. Hi, I'm Dr. Rajat Gupta. I'm a board-certified plastic surgeon working in Delhi with experience of more than 5,000 cosmetic surgeries, and here I'm talking to you about different planes of breast implant placement. Breast implants, as you know, is one of the most common cosmetic surgery done for the breast for females. There are two planes in which we can put an implant. So, what are these two planes? One of the plane is called as sub-fascial or beneath the pectoral fascia but above the muscle. So, in this technique, whether we go from periareolar or we go from inframammary technique, we go behind the breast tissue, put in the implant in front of the muscle. This implant is placed ahead of the muscle. The other technique is called as a dual-plane. This technique is done in a manner that we release the muscle from the inferior pole of the breast so that the muscle covers the upper half of the implant. Muscle covers the upper half of the implant. This portion is the muscle which is covering the implant, and the rest portion is the breast tissue. So implant is still behind the breast tissue, but the upper pole of the implant is covered by the muscle. This is called as dual plane. Now there are some rules which helps plastic surgeons define in which patient we should do for a sub-fascial, in which patient should we do a dual plane. So let's talk about that. There is a difference in the shape what you get by a sub-fascial or a dual plane implants. Let's talk about what that difference in the shape will be of your result. A sub-fascial will give you a much more rounder looking shape, a much more upper pole fullness. A dual plane will give you a much more natural shape. This is called as a teardrop shape or the shape which usually females have. This is a much more natural shape and this much is a much more rounder shape. So if you want a rounder shape, you should go for a sub-fascial. If you want a natural shape, then you can go for a dual plane. The other difference is, if the upper pole skin thickness is less than 2 centimeters, then one should go for a dual plane, otherwise there will be implant show in the upper pole of the breast. If the upper pole is more than 2 centimeters, the skin thickness, one can go for a sub-fascial because this will not show. This is understandable. If the skin thickness is very, very thin, one needs a much more covering of the implants, otherwise it looks unnatural. The third thing is, if someone is an athlete, is someone who uses their pectoralis muscle much more commonly in their day-to-day life, they're an athlete, they're a sportswoman, then one should not go for a dual plane. An athlete should go for a sub-fascial implant. So these are the essential differences between these two planes. Make sure you know all these differences. Make sure you discuss about these planes with your plastic surgeon who you're contemplating about breast implant surgery. If you have any more questions regarding breast implant surgery, please write into us. Me and my team will be there to help you. Signing out, bye-bye.